Hello everyone. The topic of today's presentation is Introduction to Application of Digital Health in Public Health. So the content which we are gonna cover in this presentation is Introduction to Digital Health, Driving Forces in Digital Health, Goals or Objective of Digital Health, Digital Transformation in Health, Advantages of Digital Health and Disadvantages of Digital Health. So coming to the introductory part, the digital health is a discipline that uses digital tools and platforms to improve healthcare outcomes. It includes digital care programs, technologies with healthcare, living, and society to enhance the efficiency of healthcare delivery and to make medicine more personalized and precise. So the driving forces in digital health they basically include five, that is lifestyle disease, aging population, raising income levels, increasing access to insurance, and growing health awareness. Then there are these are the objectives of digital health. First one is prevention of disease. Then to reduce the healthcare cost, as we know the cost of healthcare and to obtain the basic medical facilities is too high. So it's necessary to reduce the healthcare cost so that everyone can gain access to those services. Then customization of medicines as per patient requirements, which may include the personalized medicines or the personal treatment plans for individual, monitoring and managing the chronic conditions, enhancing and boosting the access so that even the rural areas can have access to basic healthcare facilities at least, expanding and improving the quality of healthcare. Okay, so all the healthcare services which are being provided should be of good quality so that the treatment outcome can be better. And the last one is facilitating the individuals at best. Then if we talk about the digital transformation that has occurred in the health, it includes telemedicine, electronic health record, assisted surgery, self-monitoring devices, IUMT, and mHealth. So first we will talk about telemedicine. It is a delivery of healthcare services where distance is a critical factor by all health professionals using ICT for the exchange of valid information for diagnosis, treatment, and prevention of disease and injuries, research and evaluation, and continuing the education. Basically, it includes the use of mobile devices, okay, which can be a smartphone, laptop, desktop, through which a person sitting from distance can avail the healthcare services from some healthcare professional. Okay, he doesn't have to um, reach or to contact the registered medical professional in personal or to go to his uh, clinic or something. They can just get the services on these mobile devices. The aspects can be teleradiology, okay, which includes radiological patient images, X-rays, CTs, and MRIs. Telenursing is there, which includes delivery, management, and coordination of care and services. Then tele-ICU, that is real-time audio, visual, and electronic means and health information. Teleconsultation, telesurgery, that is remote surgery. What are the advantages of telemedicine? It saves the cost and efforts, especially in case of rural patients, provide timely and faster access, maintenance of records and documentation, patient safety as well as health worker safety. Telemedicine can also enable the availability of vital parameters of the patient available to the physician with the help of the medical devices such as blood pressure monitor, blood glucose monitor, etc. for their management. Then, coming to the electronic health record, it is a systemized collection of patient or population electronically stored health information in a digital format. These records can be shared across different healthcare settings. It can be EMR, which is digital version of a patient's chart. EHR, it contains patient's record from multiple doctors and provide a more holistic or long-term view of a patient's health. So this is the basic example of electronic health record, okay, which includes all the information about the health record of a person, okay, stored in digital format. Then softwares which are currently used for electronic health record are Vista EHR, Epic, Athena Health, NextGen, Care Cloud, and Cerner. Then advantages of electronic health records: accurate, up-to-date, and complete information about patient is available. Quick access to patient record for more coordinated, efficient care. Diagnose patients, reduce medical errors, and provide safer care. More reliable prescribing. Privacy and security of patient data, and it also reduces the cost. Okay. Then robot assisted surgery. Nowadays robots are being used in laboratories for various purposes in industries, and similarly robots are also being used in hospital settings for surgery. Uh, like by using the robots, doctors are able to perform surgical procedures more efficiently, and with the assistance of robotics, surgeons are able to maneuver more precisely and with smaller incisions. So advantage includes reduced loss of blood, better pain management, and quicker recovery. Then micro robots are there, which are also known as microbots. These are used for diagnosis and treatment of a disease, basically capsule endoscopy, in which the patient swallows a tiny camera so that the healthcare provider can take pictures of the digestive tract. Okay, so for diagnosis purposes, this microbot can be used during the capsule endoscopy. In future, the prospects can be to remove plaque from arteries, taking tissue biopsies, attacking cancer tumors directly, and to deliver targeted medicines. Then self-monitoring healthcare devices or wearable medical devices are there, which can be any device which is autonomous, non-invasive, and that performs a specific medical function such as monitoring or support over a prolonged period of time. Like there are smart watches which we wear on our wrist. It includes the BP monitor, pulse rate monitor, oxygen level monitor, and some are also having some stress monitor or temperature monitor also. So these are the wearable devices which can help to uh, get our BP checked or something, and they can also send emergency alerts to someone in case of any emergencies like very high pulse rate or during accident. Then wearable biosensors are there, combination of wearable objects and biosensors. Again, they can measure the blood glucose level, BP, heart rate, etc., and the biometric data to be constantly measured. The real-time information is then sent to the healthcare providers, and there can be a two-way communication. Then biosensing or smart contact lenses are there. These are the wireless smart contact lenses which can help us to detect diabetes and also to treat the diabetic retinopathy just by wearing them. So the patient has to wear these lenses, and diabetic retinopathy, that is the uh, any sort of destruction in retina of eye due to diabetes. Then the IoMT, that is Internet of Medical Thing. It is the amalgamation of medical devices and application that can connect to healthcare information technology systems using the networking technologies. It can be the combination of telemedicine, which we have studied earlier, mobile technology, wearables, including ECG monitors. So ECG monitors, like there can be a set of electrode which is placed on your chest or on your fingertips and connected to your phone. It will send the ECG chart on your phone, and that chart can be shared to a healthcare professional so that he can revert back to you and give you proper uh, healthcare services. Many other common medical measurements can also be taken, such as skin temperature, glucose level, and blood pressure readings. mHealth is there, which is also known as mobile health. It refers to the practice of medicine and public health supported by medical devices, mobile devices such as mobile phones, tablets, personal digital assistants, and the wireless infrastructures. So it includes the use of mobile in our medical and public health aspects. Okay, in mobile phones, there are many apps which can help us to prepare a diet chart, which can help us to track our daily activities, physical activities mainly, and can help us to build a schedule based on our um, daily activities, based on our uh, needs for nutrition and all. So mobile diagnostics are there. Mobile phones are enabling the self-diagnostics, enabling patient to identify and manage health. Such one of such devices, Netra-G, which attaches to a smartphone, and the person can perform his own eye test by measuring the refractive error of the eye. Heart monitoring devices are there, which can be connected to a iPhone, and they can communicate through the app as well as your phone. We just have to put those electrodes on our hand, and the app will recognize the skin contact, and the ECG will be performed. It will be recorded, it will be displayed, and it will be sent to a healthcare professional also in case of any need or requirement. Then ear view. The parents can view their child's ear canal and eardrum, then share the images and symptoms with their physician remotely. Glucose management. The meter will automatically sync data with the diabetes manager tracking app, which can track glucose, insulin, and carbohydrates level while also charting the glucose patterns over time. So we can easily access these all these data, and our healthcare professional will also have access to the data. Now, some mobile apps are there for diet and nutrition apps, fitness apps like Google Fit, wellness apps, patient and provider care apps, medical device accessory apps. The smartphones we all are having, it consists of apps which can help us to prepare the diet charts, which can track our activities, which can track the calories we burnt during any physical activity. There are even some apps which can remind us for water intake. There are apps which can remind us about the stress level and our sleeping schedule also. Then advantages of digital health. The patient enjoys the digital data access, quicker access to test results, easy to pay bills, sharing the information with your family members, offers clinicians notes feedback. Patient can review information for medical errors. Instructions and information is simple and easy to document. Patient has a better approach and access to the medical records, and it can act as a tool for health protection. Now there are also some disadvantages of digital health, which includes complicated and complex health information which causes concerns for the patients. Clinicians reports elevated patient providers relationship concerns. Hackers can approach and access the patient's records, so there can be a uh, risk to the privacy of the patient. It needs to be upgraded on a regular basis because the needs and requirements of people increase time by time. Digital health records are expensive and complex and complicated process. Thank you.